I'd like to welcome you to the House, Minister. It's good to see you back here again, and thank you for all your work on the areas within your brief. And I'm conscious we did have a debate in the Seanad recently on daycare services for persons with disabilities, but my commencement matter has a specific focus. As you know, it's asking for you to outline when community social daycare facilities for older persons are expected to reopen, and when respite care facilities for older persons and their families will reopen. So it's a more specific issue. And just to give a little context, we know that many families are struggling to cope because of community social daycare facilities for older people remaining closed. We know that daycare centres are used for approximately 14,200 people in Ireland, and as a result many carers are lacking a crucial support mechanism enabling them to take breaks, to have respite. Sage Advocacy, who've been in communication with me, a support and advocacy service for vulnerable and older adults. They've been undertaking extensive research into a phenomenon known as carer burnout. I know you'll be well aware, Minister, this is seriously affecting those carers for whom services have not resumed. And we await publication of their findings, but we are well aware of this issue. Many people have contacted us all due to their own exhaustion. We know that yesterday in the Irish Times, an article by Suzanne Cahill reported that 70% of spouse carers for people with dementia had at least 2 chronic health problems themselves, a third had clinical depression, and most had visited a health service professional in the previous month. So it's clearly a wider issue around public health, as well as an issue of empathy and of compassion and of rights, indeed, for older persons. Many facilities remain closed, and thus older people may become increasingly socially isolated from their own peer group and from others, and the lack of social interaction and activity will have a negative effect on their own health, mental and physical, as well as the health of their carers. So we've had extensive discussion, I'm conscious, as I've said, in the Oireachtas, but without a time frame there's a lack of certainty. I know that the HSE is undertaking risk assessments in respect of local services. That's very welcome. I know huge efforts are being made by those working in this area to ensure that that services will be provided, and the government's position, however, remains that some services may not be suitable for reopening. And again, I understand that with current restrictions due to COVID, the usual dynamic of social interaction has changed. Some facilities may simply not be suitable. The positive news around the vaccines clearly gives us hope that in due course services will return to normal. But again, there's just an issue for so many people and their families about the lack of a time frame and the lack of clarity around when all services will be able to reopen. I know you did a PQ on this last month, stating you would ask the HSE to continue to assess the risks and benefits of reopening, as well as exploring alternative methods of service delivery for older people. So I would ask if you've received an update on this and what arrangements will be made for those for whom reopening is simply not a viable possibility in the short term. And I suppose just to conclude, you know, we've found ways through our childcare facilities, our schools, our universities and colleges, we found ways to ensure reopening, at least in some form, for people within the parameters set out to protect public health. We're discussing plans to reopen hospitality, restaurants and other sectors of society. So this is a vitally important part, clearly, of a broader discussion around quality of life, especially as we're seeing other healthcare facilities opening too. Hugely important issues around provision of healthcare for people in a non-COVID environment being recognised. And Minister, I would just ask that we might prioritise the reopening of all daycare services for older people. Thank you.
Gurv Mahago Kahirlak, and it's lovely to see you in the chair. Congratulations. Senator Batchik, I just want to thank you for the constructive way that you always raise these particular issues, because it's something that's very close to all our hearts. And I've just spent the last hour on a webinar with our Irish Rural Link, and we've spent nearly a huge portion of the conversation discussing care of the elderly, Meals on Wheels, daycare centres, active retirement groups who are hoping to come back in. So this is very timely. As we all know, community services such as daycare and respite play an important role in enabling people to continue living in their communities and maintaining their social connections. However, the introduction of physical distancing, isolation and restricted contact with loved ones has changed the usual dynamic of social interaction, as we all know. The HSE is working closely with providers and community staff to identify where service is most required, and has been undertaking risk assessments of local services. This is to ensure, insofar as possible, that daycare and respite services can resume in the context of COVID-19 and having regard for public health advice. Senator, services will resume when it is safe, when all infection prevention and control measures and the requirements of physical distancing can be maintained to provide service users and staff and prevent any further spread of the virus. Unfortunately, I'm not in a position to give you a definitive timeline. When I came into this role on the 1st of July, our aim then was to open these services in September. That's what we were working towards. And you know, the risk assessments were being undertaken throughout every CHO, and I was hugely hopeful that we would be able to open them even at a restricted level. But unfortunately, as we all know, the virus knows no boundaries. And with the escalation in the figures again into October, the end of September into October, it just wasn't possible. I'd also have to say that some daycare centres may not be suitable for reopening due to the constraints of their physical environment, and it will be necessary to continue or to expand alternative service delivery models. Some of the issues identified by the HSE include the sharing of facilities with other groups of our clients, the transportation of clients to the daycare centres where families cannot assist. This is proven hugely problematic. Some daycare centres use small minibuses, to move maybe 10 or 12 service users, and that is really problematic. And also the availability of isolation areas should a client or a member of staff become unwell. That's an issue that has been identified as well. The HSE has established a focus group to ensure daycare centres continue to be prioritised and to develop a plan to assist service providers in having a suite of options available for the provision of daycare and supports. The plan will be developed in line with the current COVID-19 roadmap. Now, I have to say additional or new home support packages are being put in place for the most vulnerable clients, with the focus on both the carers and the persons who attend the daycare services. A model of daycare in the home is currently being finalised, focused on individuals with dementia especially, and this model is being reviewed with a view to transferring it to regular daycare centres. This model will continue to develop even when the daycare centres reopen and will be based on the needs assessment and benefits for client and carers. At present, the HSE is only allocating respite provisions to clients most at risk of carer breakdown, or clients most at risk of an inappropriate admission to hospital. So as you'll be aware, Senator, the winter plan, the whole premise of the winter plan is to try and keep older people at home as much as possible and not having to transfer them to acute hospitals. So we're very conscious of those most at risk of inappropriate admission, and that's where respite occurs in that situation. I'll come back at the end. Thank you.
Well, I'd just like to thank you, Minister. As always, you've given a very comprehensive response, and I know there's more in your written response too, and I do always endeavour to be constructive. And clearly this is a vitally important issue. I think you very frankly acknowledged that while the plan had been to reopen in September, that unfortunately hadn't proven possible. But it's very disappointing, I think, and frustrating still for persons in need of these services and their families not to have any sense of a timeline at all. I mean, it's very hopeful to hear that there's a focus group being established within the HSE to ensure that services are being prioritised, and it's also very helpful to hear about alternative service delivery models and those proposals. But it would be great to have some more indication about the sort of time frame that might be envisaged by the HSE's focus group. Clearly planning is going on, and as you say, within that plan there's a recognition that some services won't be able to reopen, but that alternative methods of delivery should be available there. So perhaps you could elaborate a little more on the sort of time frame. Are we talking months? Are we talking sometime in next spring? That I think would be helpful. Thank you.
I understand completely the impact of continued delays of reopening of daycare centres and the restoration of respite services is having on older people, and the important role this service plays. My own mum actually attends a daycare centre where we live, and Mrs. going there, misses the friends and the chat, the conversation. It's hugely important. It's hugely important for people. I suppose, look, all I can say again is services will resume when it is safe. But I can't see services resuming before Christmas. That's honestly, I would be very, very hopeful after we come out of lockdown, that my aim will be that we will be able to open services even at a reduced level in the spring. That's what I'm aiming for, and I'm working very, very closely with the department and the HSE to make sure that becomes a reality. It will be difficult. Not all services will be able to reopen, but if we could open some services at a reduced capacity, I think it would give hope to very many, and I will continue to work towards that. Gorf Mahagwith.